Good day, I'm Hannah Jane Adoyo, your student nurse from BSN 3E, Nueva Ecija University of Science Technology. Today, I am going to demonstrate you the NGT insertion. Assessment, doctor's order, rationale, for type of NGT to be placed and reason for placement, check appropriate doctor's order relevant to patient safety. Client's level of consciousness and level of knowledge and understanding. Rationale, patient must be able to follow instructions related to NGT insertion to allow for passage of tube through nasal and gastrointestinal tracts. Availability and functionality of the needed materials. Rationale, the availability of sufficient modern equipment in the workplace plays a key role in facilitating care delivery, a decrease in stress and no delay to care, also patient satisfaction. Check for history of nasal surgery or deviated septum. Assess patency of nares. And rationale, nasal patency is thus a measure of how open the nose is. A true, rough, and accurate assessment is important because it helps differentiate the normal condition of the patient from the abnormal. Determine presence of gag reflex. Rationale, remember that a weak gag reflex is an important risk factor for aspiration pneumonia, so its absence may trigger intubation in at-risk patients. The absence of the gag reflex may also suggest brain death in comatose patient. Assess mental status or ability to participate in the procedure. Rationale, given the patient participation causes improved health outcomes, enhanced quality of life, and delivery of more appropriate and cost-effective services. Planning. Before inserting a nasogastric tube, determine the size of tube to be inserted and whether the tube is to be attached to suction. Prepare equipments. Large or small bore tube. Non-allergenic adhesive tape, 2.5 cm wide. Clean gloves. Water-soluble lubricant. Facial tissues. Glass of water and drinking straw. 20 to 50 ml syringe with an adapter. Basin. pH test strip or meter. Bilirubin dipstick. Stethoscope. Disposable pad or towel. Clamp or plug, optional. Anti-reflux valve for air vent if saline sump tube is used. Suction apparatus, safety pin and elastic band, and CO2 detector. Implementation. Introduce self and verify the client's identity using agency protocol. Explain to the client what you are going to do. Rationale. The first step in establishing rapport with the patient is to describe your responsibility and what you want to perform. Assist the client to a high Fowler's position if his or her health condition permits, and support the head on a pillow. Rationale, this allows the NGT to pass more easily through the nasopharynx and into the stomach. Place a towel or disposable pad across the chest. Rationale, because nasal and oral secretion may be evident during the procedure. Perform hand hygiene and observe appropriate infection control procedure. Rationale, this prevents the transmission of the microorganisms. Provide for client privacy. Rationale, privacy involves protecting patient integrity. Assess the client's nearest. Rationale, check for signs of infection or skin breakdown. If either nostril is equally suitable, select the nostril closest to the suction. Prepare the tube. Support the patient during the procedure. Determine how far to insert the tube. Use the tube to mark off the distance from the tip of the client's nose to the tip of the earlobe and then from the tip of the earlobe to the tip of the xiphoid. Mark this length with adhesive tape if the tube does not have markings. Insert the tube. Lubricate the tip of the tube well with water-soluble lubricant or water to ease insertion. Insert the tube with its natural curve toward the client into the selected nostril. Ask the client to hyperextend the neck and gently advance the tube toward the nasopharynx. If the client gags, stop passing the tube momentarily. Have the client rest, take a few breaths, and take sips of water to calm the gag reflex. Ascertain correct placements of the tube. Aspirate stomach contents and check the pH, which should be acidic. Confirm by X-ray. Place a stethoscope over the client's epigastrium and inject 10 to 30 ml of air into the tube while listening for a whooshing sound. Then secure the tube by taping it to the bridge of the client's nose. Hello, good morning, ma'am. I am Hannah Jean Idayaw and I will be your nurse for today. Is that okay? Okay, ma'am. Can I see your name tag? Okay, for clarification, can I ask what is your name?
Hermione Gaventa,
Okay, what is your birthday?
August 22, 2001.
Okay. Okay, Ma'am Kabenta, I will explain the purpose and how it works. The NGT insertion will be put inside your nose through your stomach. Then, the NGT will be used for feeding by giving you calories and nutrients. Also, we can administer the medication and the oral agents. Can I start now, Ma'am Kabenta?
You may start now.
Okay, ma'am. Thank you. Ma'am Kabenta, can I help you to put you into the high powder position? I'm done now, Ma'am Caventa. Thank you for participating. Evaluation. Evaluate the patient's response to the procedure. Document the procedure and other important data in the client's chart. And that's how you do the NGT insertion. Again, I am Hannah Jane A. Dayaw, your student nurse, and always remember our tips from Nationale. Thank you for watching!